Suppose there's one scenario, you're operating on your patient in your clinic. The patient collapses. So the patient is not responding to your verbal commands. Okay, that is one option, one scenario. Second is you're on a leave, you're just out roaming around and you see a person lying down on the floor, unconscious. Okay, so in these two scenarios, scenario one, you are legally bound to help the patient. Of course, the patient is in your clinic, he is your patient. Okay, but second, you're not legally bound to help the patient. Okay, if you wish to just ignore the patient and go on doing whatever you are doing, nobody is going to call you out. किसी को पता भी नहीं होगा आप डॉक्टर हो, right? But if you don't care, who else is going to care? You are a doctor, right? Okay, so it is ethically your responsibility, not legally, ethically. Okay, so if you don't help the patient, who else is going to help the patient, right? So today I'm going to talk about basic life support, and in that I'm going to talk about CPR and cricothyrotomy. Okay, some basic facts, physiology, anatomy facts. Now our brain, it takes up only the 2% of the total body mass. दिख रहा है कितना सा है? But it consumes 20% of the total oxygen and 65% of the total glucose consumed by our body. Okay? Now, our brain, it continues working even when we sleep. The brain works throughout your life. Okay? So, for some reason there is an interruption of blood supply to the brain, and the blood is the transport media for the glucose and oxygen, right? So if there is some interruption of the blood supply to the brain, oxygen and glucose supply is interrupted. Okay, so the brain the brain can function without oxygen or glucose for 3 to 5 minutes, but beyond that there will be permanent damage to the brain tissue. Okay, so that is the background. So now we come to death. What is death called in Hindi? Mrityu. So what is death? The great Dr. Amren Bahubali asked this question. Kya hai mrityu? He went on to give a comprehensive definition of death, but it turns out it is a little outdated. So death is just irreversible cessation of either circulatory and respiratory function or brain function. इन दोनों में से कोई एक चीज भी हुई, the patient is presumed dead. Okay? So मृत्यु के भी दो प्रकार होते हैं. First is clinical death. Now this happens when the heart stops working. There is cardiac arrest. Okay? So this occurs within 5 minutes of the cardiac arrest. Okay? Within 3 to 5 minutes of the cardiac arrest. So what are the signs and symptoms? In clinical death, of course, heart stops working, you'll see no pulse. Then you'll see change in color, cyanosis dikhega, change in color of the skin, bluish discoloration. Then we'll see patient will be unconscious and patient might gasp for breathe. Okay, even when there is no pulmonary blockage, heart is not working, the oxygen supply to oxygen is less in the blood. Okay, so the patient will be gasping for breathing, and you might see dilation of the pupils. That is clinical death. Okay, as I said, the body can go without oxygen or glucose for up to 3 to 5 minutes. Okay, beyond that, irreversible damage to the cells starts occurring. Okay, so once we cross the 5 minutes limit, biological death occurs. Okay, it occurs after 5 minutes, and this is irreversible, whereas clinical death is reversible. Okay, here the heart stops working, the body still can be revived if we make sure that the heart is not working, but you compress the heart. We'll talk about this CPR. Okay, we force the blood in and out of the heart. Okay, and we give breaths to the patient. Okay, we'll talk about how we reverse the clinical death. Biological death में क्या होता है? After 5 minutes, it is irreversible, and as I said, after 5 minutes, cell death occurs. Okay, the vital organs, kidney, liver, heart tissues, brain tissues, they all die. Okay, so that is irreversible. So what do you see? Rigor mortis. Rigor mortis mein, if you know, there is stiffness of the body. Okay, then death spot. Now if the patient is dead, and he's lying flat on the ground. So the blood pools down to the back of the body. So those red spots, they are called as death spots. Okay. Then normal surrounding temperature, room temperature is around 20 degrees Celsius, whereas body temperature is 37 degrees Celsius. Okay. This higher temperature as compared to the room temperature is maintained by body metabolism, right? Metabolism भी बंद हो गया तो क्या होगा? The body temperature falls down to the room temperature. Okay, so body temperature drops down. Okay, so now in any medical emergency, these are the steps. पहले it was PABCD, now it is PCABD. This was changed in 2015. Okay, the first is position, second circulation, airway, breathing, and definitive. In this case, it will be defibrillation. Okay, वो जो करंट मारते हैं, clear. Oh, okay. So of course, in this case, you see the patient unconscious. Okay, first you're going to check whether the patient is conscious or not. Oh, okay. Unconscious. वो line छोड़ दो. First you're going to, in any medical emergency, you're going to check whether the patient is conscious or unconscious. Okay. If the patient is conscious, you can ask the patient, "Are you all right?" If the patient does not respond, you're going to check for the pulse. First, you're going to make sure that the patient is proper position. After that, you're going to check for the pulse. Preferably carotid pulse. If you're not able to check the carotid pulse, then you can check the radial pulse. Okay. If there is no pulse, okay, that means there is cardiac arrest. So you're going to start with the CPR, but just before that, you're going to make sure there is no obstruction of the airway, because along with the compression, you'll have to give breaths also, 30:2 ratio mein. Okay. While if you see that there is no pulse, there is cardiac arrest, ask your assistant or someone who's with you to call for medical help, and while you start performing the CPR. Okay. So now we'll go to individual steps. So in the position, what do you think? Which is the ideal position for the for any medical emergency? हाँ, कोई एक बोलो. कौन बोला अभी? सुपाइन कौन बोला? यहाँ से कोई बोला? I'm not going to shout. गलत भी बोला तो चलेगा. हाँ? Who says supine? हाथ ऊपर करो. Who all support the answer supine? And who says Trendelenburg? Okay, हाथ नीचे ले लो. Now, the most obvious answer जो usually तुम लोगों को शायद पढ़ाया भी गया है, and you guys know, is Trendelenburg. Now the problem with Trendelenburg is, if basically what is Trendelenburg position? The patient is inclined position. The head is below the level of the heart and feet are above the level of the heart, right? Inclined. Now the problem with this is, if the patient is inclined, the diaphragm, it compresses over the lungs. Okay, so the lungs, when the patient breathes, or if you give breaths to the patient, the lungs will not be able to fill with oxygen to the optimum level, जितना कर सकते हैं capacity में. Okay, so this is not ideal. Trendelenburg. Okay, ideal is supine, flat on the ground, and feet elevated. So basically, your head and your heart at the same level, whereas feet are elevated above the level of the heart. Okay, this is to facilitate venous return to the heart and easier supply to the brain, easier blood supply to the brain. Okay, these are all the examples of the same position that I told you: flat, lying flat on the ground and feet elevated. You can use a chair, you can use any support. Okay, in your dental chair, you can keep the patient supine and feet elevated. Okay, this is the ideal position for a normal patient. Now, if the patient that you are managing the medical emergency in is pregnant, okay, so you guys know left lateral. So, but I'll explain क्यों होता है. Can you see this blue? What is this? Inferior vena cava. लिखा हुआ है, बोल तो दो. So inferior vena cava, right? It is slightly on the right side of the vertebrae. Okay. So if you see the cross section, this is the vena cava, ये वाला. Okay. So it might gets compressed between the fetus and the vertebrae. Okay. And the heart gets the venous return from the superior and inferior vena cava. So एक तो बंद हो गई supply. Okay. So venous return to the heart is reduced, and that will lead to reduced cardiac output. Okay, if the patient is lying down supine. Okay, so because of the reduced cardiac output, the patient might experience syncope, unconsciousness, or reduced blood supply to the brain. Basically, वो होता है. Okay, so what do you do? This is on the right side, slightly on the right side, right? So to avoid compression of the inferior vena cava, we are going to ask the patient to tilt on the left side, approximately 30 degrees, but protractor लेके measure नहीं करना है, just left side करवा दो. Okay, so this is the ideal position for the pregnant ladies. Okay, so now we check for the pulse, C for circulation. Okay, we check for the carotid pulse. If the carotid pulse is not, you're not able to palpate the pulse, you can go for radial pulse. Okay, and this is an emergency. So what you are taught in your physiology class कि पूरा 1 मिनट चेक करना है, वो नहीं करना है. एंड जो चीटिंग तुम लोग करते थे 15 सेकंड चेक करने के बाद यू मल्टीप्लाई बाय 4, वो करना है यहाँ पे. दिस इज एन इमरजेंसी, सो यू काउंट द पल्स फॉर 15 seconds and then you multiply by 4. Okay, so if you don't see any pulse, then you're going to start with the CPR, which is cardiopulmonary resuscitation. इसमें दो चीजें, कार्डियो एंड पल्मोनरी. कार्डियो इज circulation, heart. Pulmonary, breathing. Okay, so before you start with the cardiopulmonary resuscitation, you're going to check for the airway obstruction, if there is any airway obstruction or not. Okay, वो मैं बाद में बताऊंगा कैसे करते हैं, but you should remember कि before starting CPR you have to check whether there is airway obstruction or not. Okay, now if we cut this, guys, एक slice निकाल देंगे chest से, what are you going to see? You're going to see the lungs and the heart. Okay, and the skeletal muscles. So basically the heart has stopped working. Now you can imagine the heart is like a balloon. Okay, उसके अंदर blood भरा हुआ है. We apply pressure over the heart, the blood is pushed out. When we allow the balloon to recoil, pressure हटाते हैं, the blood is pulled in because of the negative pressure, right? And if we repeat the same process, press करेंगे, blood is pushed out. We allow it to recoil, the blood is pulled in. Okay, basic, simple. Okay, बस वही करना है CPR में. So we apply pressure, we push the blood out, and we allow it to recoil, and the blood is pulled through the vena cava, superior and inferior vena cava. Okay, I'll show you a video. Okay, after this. So what do you do in CPR? When you start compressions, the patient has to lie on a hard flat surface. Okay, because you're going to apply too much pressure, you're going to push this sternal bone. Okay, it is quite stiff, so इतना pressure लगाना है, so you need a hard flat surface. If the patient is on a soft surface, आप pressure लगाओगे भी, that pressure will be absorbed by the soft surface. Okay, so make sure the patient is lying on a hard flat surface on his back. Okay, like this, on the ground preferably. So your fingers, they should be intermingled. Okay, and you're going to apply the force with your heels of your hand, यहाँ से. Okay, let's see. Of course, you have to. You're not going to straddle the patient. You're going to sit on the side of the patient. Okay, and your heel, elbow, and shoulder, they should be in one straight line. ऐसा straight रखना है. Okay, this should not bend. Can you see? This is in one straight line. Heel, elbow, and shoulder. Okay, let's see. Loosen the patient's clothes. Heel is kept over each other. Okay. Okay, the point where we apply the pressure for compressions is just above the xiphoid process. This blue color is the xiphoid cartilage. Okay, just above that point, approximately 1.5 centimeter, we apply the pressure over that portion of the sternum. Okay, basically यहाँ you can say we are using the lever principle. It is attached there. यहाँ पे हम जितना नीचे तक pressure लगा सकते हैं उतना ज़्यादा compression होगा. Okay, so this is the ideal site. So that is one. And as I said, the shoulder, heels, and elbow, they should be in one straight line. Okay, and the compression should be approximately 2 to 2.5 inches. Okay, the chest should be compressed 2 to 2.5 inches. Okay, that is approximately 5 to 6 centimeters. Okay, the hip movements are to be done at the compressions are to be done at the hip level. All of your upper body weight should be transmitted to the patient's chest. Okay, I'll show you the video कैसे रहता है. And at the end of each compression, जैसा मैंने बोला, when you apply pressure, the blood is pushed out through the aorta, right? But you have to allow it to recoil so that the blood is pulled in through the vena cava, superior and inferior vena cava. Okay, so you have to allow the chest to re-expand. Pura pressure kiya, and then you have to allow it to re-expand. So we apply pressure and we allow it to re-expand. We allow it to decompress. So the number of compressions is 100 to 120 compressions per minute. You should remember 2 compressions per second. Okay, that is 120 compressions per minute. Okay, so let's see. What is this? Okay, yeah, this is that video. So you can see the heart is there. So when we compress, if the heart has stopped working, there is no blood in the veins and everything, in the veins and arteries. So initially the heart, when we start compression, the arteries, they are filled with blood and the blood is pushed to the extremities. Once the blood has reached the extremities, wahan se the venous return starts. Okay. So initially it might take some time for the venous return to take place, but you have to keep compressing, and then when you compress, the blood is pushed out. When you allow it to recoil, the venous return occurs. Okay. So now you tell me, is this the correct way of CPR? What is wrong in this video? Elbow. And she's not sitting on the side of the patient, of course. Okay. Now there's one more video. Ye to bahut nayi video hai. This happened last month. An IS in Chandigarh, he gave us CPR. And they actually posted this video online with this caption. Do you think this is correct? He's just pushing the patient backwards. Patient is conscious and he's saying, "Ruk ja." Can you see? So this is not how you should do that. Okay. This is the ideal method of giving compressions. Okay. Now you can see the patient is sitting on the side of the operator is sitting on the side of the patient. Heels, elbow and shoulder in one straight line. Okay. And just watch how she's applying compression. The movement is at the hip level. All of the upper body weight is being transmitted on the patient's chest. Okay. And she is giving approximately 2 compressions per second. Can you see? This is the ideal compressions. Okay. So in infants में ये नहीं कर सकते ना, पिचक जाएगा बेचारा. So in that what you do is you use 2 fingers and you just apply pressure with your fingers. Okay. And कितना compress करना है? Half the depth of the chest cavity. Okay. Watch. Just fingers. Okay. So this was circulation. As I mentioned earlier, आपको पहले airway check करना होता है before starting the CPR, because airway and circulation is going to go together. Okay. Now in airway, let's talk about some anatomy first. Now can you see this? This is the tongue which is attached to the mandible. कौन सी muscle से? हाँ? Genioglossus. Okay. Okay. That is one. Then we have this epiglottis. We have the thyroid cartilage. Can you see? This is the thyroid cartilage. हाथ नहीं पहुंचेगा अभी छोड़. So this is the thyroid cartilage, and below that we have the cricoid cartilage. This, okay, and we have a small membrane between the thyroid and cricoid cartilage in the front. That is cricothyroid membrane. Okay, this will come into play later on. Okay. So now if the patient is unconscious and lying down, क्या होगा? Patient loses all the motor control. The tongue falls back. Right? There will be air. कुछ भी foreign obstruction नहीं है, but there will be obstruction because of the tongue. Right? So if the patient is unconscious, what do? Can you see? The tongue falls back into the throat. There is an airway obstruction because of the tongue. Now, how do you pull the tongue forward? As I told you, the tongue is attached to the mandible. You just pull the mandible, tongue आगे आ जाएगी, right? So we do something called as head tilt and chin lift. Okay? Head tilt में क्या करते हैं? We place a palm of the hand on the patient's head and we rotate the head and we engage the genius, the bone, lingual surface of the mandible, okay, in the chin region, and we pull it. Okay, so the tongue is pulled forward, but this is not preferred in case of when you suspect cervical spine injury. That is when we don't use this, because we are tilting the patient's head. It might aggravate the injury. Cervical spine injury aggravate हो सकती है इससे. So what do we do then? We use something called as jaw thrust. वो बाद में बताएंगे. Just watch. This is the head tilt chin lift technique. So we place the palm of the hand and tilt the head back and pull the mandible forward and we open the mouth. Now open क्यों करना है? Because we have to check whether there is any foreign body there or not. Okay? अगर क्लिनिक में पेशेंट है तब तो आपको पता ही होगा कुछ गया या नहीं गया. But if in the second scenario जो मैंने दिखाया था, in that you don't know क्या हुआ है. Okay, then you'll have to check everything. Okay, so this was head tilt and chin lift. Then, as I said, you can't use this technique in cervical spine injury. Then we can use jaw thrust. In this, what we do is we engage the patient's mandible at the posterior border of the ramus and we pull it forward. Okay. Now there are multiple methods in this picture. It is being shown that we engage the posterior border, we pull it, and using the thumb we open the mouth. Okay. And then there is another where we use the thumb to take support from the cheekbone, from the zygomatic bone, and then we pull the jaw forward. Okay. So these are the two methods. Now again, jaw thrust is used in case when we suspect cervical spine injury. Okay. Now airway obstruction. Now this airway obstruction can be because of foreign body. There is some foreign body that is lodged in the patient's throat. Okay. Or it can be because of some other condition like allergy, anaphylaxis. Anaphylaxis means we can see airway obstruction at two levels: laryngeal edema and bronchospasm. Right. Bronchospasm तो we are going to manage with medicines. Okay. Epinephrine देते हैं हम, bronchodilators देते हैं. That is a different thing. But if we have laryngeal edema, if you remember, let's see. Let's go to the anatomy part. So this is the larynx. Okay. We have the vocal cords. Laryngeal edema में क्या होता है? These vocal cords. There is swelling of the vocal cord and they are shut closed. There is no airway exchange at the vocal cord level here. Okay. So now we know यहाँ पे airway obstruction है. So we will have to open the airway below this level so that the patient can breathe. Okay. Okay. So how do we prevent any foreign body while you are performing a procedure in your clinic? First is rubber dam use karo, so that for any dental any RCT procedure, so that there is no slippage of any instrument in the throat of the patient. Or your assistant should be trained enough so that the assistant can, if there is any foreign body that has slipped into the patient's throat, the assistant can use the Megile's forceps and just pick it out. Okay. Then chair position is important, because if the patient is upright or semi-supine and if something goes into the patient's throat, जैसे कोई crown चला गया, gravity is pulling it downwards, right? तो पूरा अंदर जा सकता है, even if it goes into esophagus or the larynx, that is a different thing, into the trachea. But if the patient is totally supine, throat में जाके रुक जाएगा, because the gravity is pulling it downward, right? So ideally supine position should be preferred. So suppose if there is any foreign body in the patient's airway, the first method that you can use is Heimlich's maneuver. Suna hai? In that, what we do is we just place our thumb. One thumb is kept like this, second hand like this, and we place the hand just 1 inch below the above the navel, 1 inch above the navel, and we apply the pressure upward and backwards. Okay, upward and backwards, not backward, not upward, upward and backwards. So what we are doing is we are increasing the pressure in the lungs. We are applying sudden pressure, so the air is expelled out of the lungs with force. Okay, so because of that force, if there is any airway obstruct, there is any foreign body that might be expelled out. Okay, now this Heimlich's maneuver can be used in patients where the patient is conscious. Okay, you can't hold the unconscious patient like this, right? He doesn't have any motor control. Suppose you don't, this is the same thing as I told you. Okay, so suppose if you can't do Heimlich's maneuver, you can just use chest thrust. Just we keep the hand at the side, जहाँ पे मैंने बताया CPR देते हैं, at the sternum, right? We keep your hands there and we apply the pressure just backward. Here the target, again the same thing, we are increasing the pressure in the sternum so that we compress the lungs and the air is expelled out by force. Okay. In kids, we can ask the patient, the child patient to bend forward and we apply back blows. Okay. Now in this, we try to dislodge the foreign body from the trachea, larynx or esophagus, whatever it is. And if the patient is bending downwards, so the removal of the foreign body is facilitated by the gravity. Gravity se pull hoga. If the patient is standing upward and if the foreign body is dislodged also, the gravity is going to pull it back downwards, right? So we have to make sure that it comes out. So black. Now this is a modification of back blows by Dr. Govinda. So you can see Johnny Lever has a obstruction. I'll just fast forward. So he's going to give back blows. And there is a modification of back blows. वो end में आएगा. Now this is the modification, Dr. Govinda's modification. Okay. So back blows. So in kids, you're going to hold the child forward and downwards. Okay. And you're going to give back blows with the palm of your hand. Okay. And give the back blows. If the patient is unconscious, you're going to give chest thrusts. Okay. The placement of your hands will be the same, 1 inch above the navel, and you're going to apply the pressure upward and backwards again. Okay. In this case, relative to the patient, but if you look at like this, it is downward and backward. Okay. So in case of laryngeal edema mein I told you there is swelling at the level of vocal cords. Okay. So there is complete obstruction. There is no airway exchange. Okay. So you have a few minutes just to save the patient, to re-establish the airway of the patient. In that, what we can do is, this is the healthy vocal cord and this is a vocal cord in edema. There is completely blockage of airway, so the patient can't breathe. So to re-establish the airway in such patient, we have two options. One is cricothyrotomy, second is tracheostomy. Now tracheostomy, it is going to require surgical skills. You're going to need surgical training for that. Whereas cricothyrotomy, koi bhi kar sakta hai, itna simple hai. I'll show you. Cricothyrotomy is also called as cricothyrotomy. Okay. Now I'll repeat the anatomy part. If you see, you have Adam's apple, especially males may it is very prominent and females may it's not that prominent, but you can palpate this. Okay. This is your thyroid cartilage, this portion. Okay. When you come down, you'll feel the cricoid cartilage. उन दोनों के बीच में you'll feel the depression. That depression is this cricothyroid membrane. Okay. So you just supposed to give an incision in the membrane, and you're going to go into the larynx. Okay. So basically इसके ऊपर सिर्फ दो layers होती हैं above the membrane. We have fat layer and the skin, and there are no important vital structures are there. यहाँ पे side में we have the strap muscles, but वो नहीं आएंगे if you give a proper incision at a midline. Okay. If you give a vertical incision, कुछ नहीं होगा. Okay. Now I'm going to show you a surgical technique which is, this can be done within a minute. Okay, ये हुआ नहीं. Let's see. Okay, so these are the instruments: 11 number blade, skin hook, and a dilator. Okay, and this is a tracheostomy tube. Okay, as I mentioned, you're going to palpate the which thyroid cartilage. You're going to come down. Cricoid cartilage, उन दोनों के बीच में will have the cricothyroid membrane. Okay, so उसमें we're going to give a vertical incision in the skin. Once you give the vertical incision and you go through the fat layer, you will be able to visualize and palpate the membrane. Okay, this is the membrane. Now in this, it is better you give a horizontal incision in the membrane because it will have a wider area. Okay, and once you have given the horizontal incision, you just insert the dilator, open it, and just insert the endotracheal tube. Simple. अगर time है, you can give local anesthesia at the site. अगर उतना भी time नहीं लग रहा, you can directly give the incision. वो time पे patient नहीं बोलेगा pain हो रहा है. He is more concerned about his life. So we're going to use the dilator, insert it and open it. We will widen the opening and then we'll insert the tube. Okay. This is going too slow. So we insert the tube through the dilator and we secure it. Okay. Now this doesn't have a cuff. If you see, आपने अगर intubation tube जो होगा, endotracheal tube होगा, उसमें we have a balloon cuff. It is used to stabilize the uh, tube inside the trachea, whereas इसमें you don't have a cuff because this is a temporary measure. As the patient is shifted to the hospital, okay, वहाँ पे the tracheostomy, emergency tracheostomy will be performed. Okay. So in case you're not able to do that, आपके पास ये सारे इंस्ट्रूमेंट नहीं है, then what you can do is you can perform emergency cricothyrotomy, which is use a 11 number blade and give a vertical incision through and through. अब ये मैंने बहुत सालों पहले मेरे पीजी टाइम पर वीडियो शूट करी थी, तब से यही चला रहा हूँ मैं. So just give a through and through incision, back side of the blade, insert and rotate. बस, that's it. Okay. If you don't have a blade, you can use 3-4 18 gauge needles and just insert it there. इससे easy कुछ नहीं हो सकता. You're just inserting a few needles and the patient will be able to breathe through those needles. Okay. Again, this is a temporary measure. As soon as the patient is shifted to the hospital, ये सब हटा के tracheostomy हो जाता है. Okay. वो भी नहीं है, then you can use a sharp object to give an incision and use a pen barrel. Okay. So I'll show you a video. किस किसने 100 देखी है? तूने देखी है. Okay, so in this movie, I think this was Saw 5. The guy's head is locked inside a glass cube filled with water. He can't breathe, so he performs a cricothyrotomy on himself. He takes out the pen. He stabs the neck with the pen. And then takes out the refill and everything, and the patient is able, the guy is able to breathe. Okay, so tracheostomy, as I told you, it is going to require surgical skill, surgical training चाहिए होगा. It is done usually in the hospital setup, and there are two types: emergency, which is done vertical; elective, that is horizontal incision. Okay, I'm not going to go deep into this topic because this won't be an option in case of an emergency. Okay, now once you have established a proper airway, if there was a foreign obstruction, foreign body obstruction, you've removed that. In case you had laryngeal edema, you've done the tracheostomy, cricothyrotomy किया आपने, you have established the patent airway. Okay, then you're going to check for the breathing, right? आपने airway establish कर दिया और you check the airway that there was no obstruction, but you have to check whether the patient is breathing or not, right? How do you check whether the patient is breathing or not? There is something called as look, listen and feel. Okay. So you're going to keep your ear close to the patient's mouth. Okay. You're going to hear the, first of all, look part. You're going to keep your eye on the patient's chest. If the patient is breathing, the chest movement will be clearly visible. That is one. Look. Then you're going to listen for the air coming out of the patient's mouth or the nose. Okay. That is listen and feel. A patient इतनी तुम्हारा सर इतना close है patient के पास में, so the air, warm air is going to hit your earlobe, right? So you're going to feel the warmth of the air coming out of the patient's nose. Okay, so this is look, listen and feel. Look for the chest movement, listen for the air passing through the patient's nose or mouth, and feel the warm air. That's it. Okay. So now आपने देखा होगा माउथ टू माउथ होता है, but nowadays it is more preferred to use mouth to mask. अगर आपके पास मास्क है तो, okay. So again, you're going to tilt the patient's head, okay, and then give the breaths to the patient. Now, इसमें भी, as I told you, if you suspect cervical spine injury, you're not going to do this, okay. Tilt नहीं करोगे, but you're going to give breaths. Preferable is mouth to mask, okay. Now, the ratio is, आपने ये तो देख लिया 120 compressions per minute करना है, but कितने breaths देने हैं, you don't know. That is, the ratio is 30:2. If you're the single operator, after every 30 compressions, you're going to give 2 breaths to the patient. Why do we do this? Compressions तो दे रहे हैं, we are pushing the heart, we are making sure that heart भले काम नहीं कर रहा है, we are forcing the heart to work. circulation re-establish कर रहे हैं हम. But if there is no oxygen added to that blood, there's no point of the circulation, right? So you're forcing the air into the lungs of the patient, right? So that oxygen is added to the blood. So you're doing the function of lungs and the heart both. Okay. So the compressions are 30:2. Okay. After 30 compressions, you're going to give 2 breaths to the patient. Okay. That is one person. Agar do hai, so the other person is going to use the same ratio, but you keep continue giving the compression and the other person is going to give the breaths. Okay. Now the problem here, you're not supposed to blow air with too much pressure. Okay. I'll tell you kya problem hogi. First is, if you apply too much pressure while blowing the air, you might push the air into the esophagus. You have the larynx and the esophagus close to each other. You might push the air into the esophagus. Ab esophagus mein gayi, through the esophagus, the air might be pushed into the stomach. Wahan pe we have the gastric juices, gastric acid. It might be pushed up. Gastric content, be it liquid, solid, it might be pushed out and into the larynx. Okay. So you have to prevent that. There is a technique to prevent that. I'll tell you that later on. Okay. So just remember that you are not supposed to apply too much air pressure. Now, ये तो मैंने बता ही दिया. We have the larynx, we have the esophagus. Okay. So there is something called as Selleck's maneuver. So if you see cricoid cartilage, this is something like a ring around the larynx. So if you move the cricoid cartilage, the whole larynx moves, right, along with the cricoid cartilage. What you can do is, if you apply pressure over the cricoid cartilage, you push it, पूरा larynx पीछे push होगा and you will be able to block the esophagus. इसको बस पीछे push करेंगे तो. Can you see this? We push the cricoid cartilage back and we are closing the esophagus. But as this cricoid cartilage, it surrounds the larynx. The larynx बंद नहीं हुआ है. Okay. Once you have done this and then you give breaths, be it mouth to mouth or mouth to mask or be it using ambio bag. Now the air will be pushed into the lungs, trachea, right? आपने esophagus का रास्ता ही बंद कर दिया. So now CPR is just to buy some more time to the patient. You are just making sure that biological death doesn't occur. Okay, clinical death हो गई है patient की. Biological death नहीं होनी चाहिए, because we are making sure that the blood supply and the oxygen supply is there to the tissues. So we are preventing any permanent cell death of the body. We are doing this CPR to buy more time so that medical help arrives and the patient can be defibrillated. Current लगा के patient को, we are going to revive the patient. We are going to make sure that the heart starts functioning by itself. Okay. In that we are going to give epinephrine also, but you do this so that we can do this. Okay. So that is the last one. Definite में आएगा defibrillation. Okay. Now, just to recap, in compressions it was 100 to 120 per minute, whereas in breathing we had 30:2 ratio. Okay. Now you can't go on infinitely. कभी तो रुकना पड़ेगा अगर पेशेंट रिवाइव नहीं हो रहा है, राइट? सो वन इज, इफ द पेशेंट रिवाइव्स, नहीं करना है. जैसे वो वीडियो में देखा पेशेंट ही बोल रहा था रुक जा भाई, सो यू कैन डू दैट. पेशेंट बोलेगा रुक जा, देन यू हैव टू स्टॉप व्हेन द ट्रेन्ड हेल्प अराइव. रिमेंबर मैंने बोला था आपको पहले, while checking for the position and pulse, you're going to ask your assistant or your friend to call for medical help. Okay. That is that. Once the medical help arrives, you can stop and let them take over. If you are too exhausted to continue, आपने आधे घंटे से ज़्यादा same movement कर रहे हैं, you will be tired. Okay, you can't keep on doing this for hours. Okay, you have to stop at some time. If the scene is unsafe, now for some reason वहाँ पे आग लगी हुई है, for some reason या फिर earthquake आ रहा है, you're not going to give compressions to the patient. आप खुद नहीं बच पाओगे. You have to check for the safety of yourself first. Okay, and then if the medical help arrives and the doctor says, medical physician, that the patient, you'll not be able to revive the patient, so you can stop. And if the cardiac arrest is for longer than 30 minutes, आप 30 minutes से ज़्यादा compression दे रहे हो, then you can stop. Beyond this, you will not be able to revive the patient.